From Jessica to go ahead and get started. So welcome to the 2022 North Carolina Home Visiting Parenting Education Summit. And this session is Building Our Community of Practice, a town hall discussion to shape North Carolina's HVPE system. And I'm feeling a little bit intimidated going into this session after listening to our wonderful parents on the panel. And I'm just so inspired and in awe of them. I hope if you didn't get a chance to listen to it, that you go back and listen. So thank you for being here. And go on to the next slide. Just to keep us grounded and to let everybody know that we're all have the same goals in mind. We're heading in the same direction. I wanted to read this vision statement to us. All families will have access to a range of parenting education supports from the prenatal period to age 8 within a coordinated delivery system, which will positively impact parent-child relationship and family and child well-being. And that's what our parents were asking for at this last panel. So we're going to work to do that. And your input, as well as the parent input, is so important. And that's what we're here for today. So you can go ahead to the next slide. Talk about our objectives, what we want to do today. Or this is our outline of what we're going to do today. We're going to welcome everybody. So welcome everybody. I've done that. We're going to talk about the objectives of this workshop. I'm going to talk a little bit about the background of where this group came from, how we got started, and the core competencies. Then we're going to ask, and we really want some feedback from you all about some different things. So it's going to be kind of a town hall discussion virtually. And then we're going to talk about next steps and wrap it on up. So the first thing that I want to do is go back. Whoops, we need to go back to our poll. The who's in the room poll. So we have a poll that was just popped up. And we want to know who's here. We want to know whose input we're going to get today. And I love that we're seeing mostly direct service folks. That's awesome. Thank you all for putting in here. And you guys can see who's in the room, right?
I think they won't see the responses until we finish the poll. So just a few more folks to vote, and then we will close it out.
Okay, thanks, Jessica. So I was cheating. I was telling you who we're seeing the most because I can see the poll. So I'm sharing with you.
And some have also said in the chat that they fit in several different categories.
Yep, that's usually the case. When we're doing home visiting and parenting education, we all wear several hats a lot of the time.
All right, looks like the majority of folks have answered the poll. So I'm going to go ahead and share these results.
Thank you. So as you guys can see, most of you are home visitors or parenting education. You're doing the direct service work, and then we have a bunch of supervisors. administrators and program staff, and a couple of parents. So yay, I'm so glad. All righty. So we can go on to the objectives. And I think, Mark, were you going to speak about these? Although my name's on there.
I can. Yep.
Okay.
So yeah, we've got a couple of things that we want to, hopefully accomplish this afternoon as we go through the presentation and really more getting information from you folks. We hope that all y'all who are participating will leave with an increased knowledge on, what the system is, how the system can help us in the field, and how you individually can fit into that system and add to that system so that we can provide the most effective work that we can and support that we can for parents and families across North Carolina. And we really want folks to feel like and understand that your input is a key part of the system, that it is useful and it will be used, and it has been used in the past, as we've had a number of these presentations at the Home Visiting Summit over the past couple of years, and that it will promote change. The fact that we're sitting here right now and we have Rachael, who is our director of our home visiting and parenting education system work, is I think a direct example that the input folks have given to this point is not just been gathered so that we can increase our knowledge, but so that we actually can do something with this, with that knowledge and with that information and the suggestions. And that's the purpose of today as well, is to continue to get some of that information and suggestions so that we can continue to increase our ability to support families and kids across North Carolina. And that sort of hits that third bullet point there. And then, like I've been mentioning, we really want to spend some time, and that's going to be the majority of the time that we have together, really getting y'all's input around what are the training needs that need to be filled, can be enhanced, added to, so that, again, we can really advance the work of the field here in North Carolina and hopefully across the country, being able to have such a well-developed system that it becomes a model for other states. And then we want to get some information about what other technical assistance and supports programs and staff could use, again, so that they can better serve the families that they are working with and supporting. And we can move on to the next slide here.
Hey, Mark, before you go any further,
Yes,
I
ma'am.
jumped in and I was so excited about blabbing about the parent panel and jumping in and getting us going that I neglected to let everybody know who we were.
Yeah.
So just real quick, I'm Patty Lehrman. I am the state leader for Parents as Teachers and have been involved with this work from for several years now, and really believe in what we're doing and really want to bring this work together and hear from everybody to really push it forward. So that's who I am, Mark.
And I'm Mark Ownbey. I'm the Healthy Families America State Consultant for the North Carolina Maternal Infant Early Childhood Home Visiting Team. That's part of the Division of Public Health. And I've been in the parenting education and home visiting field for 32 years now. So yeah, doesn't mean I've learned much, but I've learned a lot from the parents and families and kids that I've worked with, as well as other good professionals. So hopefully that's what we're looking for us to be able to get that collective knowledge into the system and improve that system work. We're talking specifically the programs committee that is part of the home visiting and parenting education system that we are working on developing here in North Carolina. And the work of that committee really started even before the home visiting and parenting education system work started. a number of years ago, a number of folks from the Home Visiting Collaborative got together to really talk about what could be done to really enhance the professionalism of the field and increase the effectiveness of those supports here in North Carolina. And that work started a lot along the lines of really looking at developing core competencies for the field to be put into use here in North Carolina. And that work has now been incorporated into the programs committee with the HVPE system. And, you know, that work is really includes all the models. We have a number of models and approaches for home visiting and parent education in North Carolina. And it is really a goal of the programs committee to ensure that that inclusive nature of the work continues. All those models and approaches are there for really good reasons, because we know that there's no one size fits all. And we have a lot of different communities we work with. We have a lot of different family types that we work with. We have a lot of different, areas where families and kids can benefit from support, and everyone has a little bit different place where they sort of fit in the continuum of that. And so we want to make sure that that continuum is built out, and that really does mean that we want to include as many models and approaches in home visiting and parent education that we possibly can, so that families ultimately have the choice about what is going to be best for them and in their circumstances, and have that choice. And that's one of the overriding sort of ideas behind the work of the programs committee, is continuing that. And along those lines, we want to make sure that we learn from each other, so that, those best practices that are common across the different models really get elevated and sort of highlighted, so that everybody has the benefit of that, and then continue to learn what those best practices are as new models come into the state, and as people really work to change the implementation of models to adapt that to circumstances, to keep up with what the state of home visiting and parenting education looks like in North Carolina. And we really want to promote true collaboration and mutual support, because it's really easy at the program level to become sort of isolated and competitive, the way funding requirements are and model requirements are. It's real easy for the field to become fragmented, and we really want to promote that collaborative effort to join together. And then we want to make sure that program and staff needs are met, so that they're able to deliver effective and responsive and high quality services to families, regardless of the model or the funder. That there's that equitable approach to the field at the local level. And then we want to try to really share, harness the shared needs and opportunities, so that we can respond as a system. And if we can sort of get that quantity of scale that you get with system work, then that makes the field much more cost effective to deliver services. And it also cuts down on duplication of services a lot of times as well. And we want to do all those things in a way that supports programs implementing, again, with fidelity to the models, so that those individual strengths of the different models and approaches are respected across the board, and that individuality is fostered. So this work is not to try to create some monolithic behemoth where we all do the same things and say the same things, but really to create that system where all those different approaches and models can flourish. And you guys who are doing the work on a daily basis in folks' homes and with parents, doing parenting education benefit from that, and ultimately our parents and families feel that increased support. And then, along those lines, currently the programs committee has 19 different agencies and organizations that are actively participating in that. I'll just run down the list real quick so you can get a sense of that, because it's state level and also local level participation. So we have Ashe County Partnership for Children, the Blue Ridge Healthy Families Program, Book Harvest, Center for Child and Family Health, Child First, Children's Home Society, Cumberland County Partnership for Children, Easter Seals, the Enola Group, Family Connects International, the Frank Porter Graham Child Development Institute, Healthy Families America, New Hanover Partnership for Children, North Carolina Department of Health and Human Services, North Carolina McVie Team, the North Carolina Partnership for Children, Nurse Family Partnership, Parents as Teachers, and 0 to 3. And that's the most current roster I had access to. So if I left anybody out, I apologize for that. And we are actively, asking for folks who want to participate to do that. We'll give you contact information for Rachael Burrello at the end of our time together, so that anybody who would like to investigate being part of the programs committee can get in touch with her, and we'll get you plugged into that. I think we can go ahead and move to the next slide here. So a couple of ways that, we really want to impact the field with this systems work. One of those large sort of outcomes that we're looking for in the area of providing quality supports for programs is that professional supports aligned to core competencies. And some of the strategies that are in place to address that goal and to reach that outcome are: one, we want to determine a set of core competencies, and we'll talk a little bit about that real briefly here in just a minute. And that work has already been going on for a number of years, and we want to make sure that we are not only just looking here in the state, but that we're looking nationally. What are sets of competencies that have already been established, how those fit into the work that's going on in North Carolina, that type of thing. And then we want to really develop a plan so that those core competencies are usable. They're accessible to folks, they're consistent, and they are integrated in the education system as we prepare workers for the field, that they are part of the professional development systems that folks have in place and that we have in place in the larger system work that we're working on, and that there are ways for folks to attain certification or some type of endorsement so that they can demonstrate those competencies are in place. And we will go ahead and move to the next slide here. And then another goal of the system work is to really have impact. Again, we want what we do in the programs committee to ultimately improve the supports that families and parents and kids are getting across the state of North Carolina. And one of the outcomes that we really believe can push us toward that goal is that the development and training and technical assistance that home visitors, parent educators, supervisors, everybody in the field can benefit from really are aligned. So that as a result of that, hopefully we see increased retention of staff and improved organizational quality and sustainability as well. And again, some of the strategies that are in place and that we will be looking at how we can impact that goal are launching statewide professional trainings, needs assessments. We're going to be doing a lot of that here in just a little bit as part of this time today, and ensure that professional development approach includes program management as well as professionals who deliver that technical assistance and coaching. So again, we want that system to be comprehensive, So it's not just aimed at direct care providers and practitioners, but it's also focused on all the levels of roles and responsibilities that are there within the field to help folks continue to develop those skills and get access to the support that they need in those ways. And then engaging with Prevent Child Abuse North Carolina to support continued assessment of training needs across parenting education models and home visiting models as well. So let's move on to the next slide here. So I mentioned the core competencies. That is some of the work that's been going on for a while. We started back in 2018 with really looking at what's a comprehensive knowledge base that folks in the field should all be sort of operating on as a foundation. And so we spent a lot of time looking at a number of different competency sets. And you see 3 of those that are there that really have sort of guided the work to this point. The National Family Support Competency Framework for direct service professionals, the Alliance for the Advancement of Infant Mental Health, Infant and Early Childhood Mental Health Competencies and endorsements, in the National Parenting Education Network, Parenting Educator Competencies in North Carolina Parenting Education Network's credential. Hopefully part of the work we can do is to get a title that we can all pronounce without having to take 3 or 4 breaths in that. But we have made recommendations to the home visiting and parenting education system, folks who've been working on that subcommittee. They should be attached to the session somewhere or another. Rachel, Jessica, Sarah can let us know about that. But they're entitled Recommendations for the Home Visiting and Parenting Education Core Competency Work Group. So if you want to look at those in depth, you have the availability to go back and take a look at those kinds of things. And so we're finalizing our recommendations for those core competencies. And then the next step of that piece of it is to really look at how we operationalize those things. How do we put the supports in place that folks need to really make use of those across the field? And Jessica just posted where those things are there in the chat. Patty, Rachel, anything to add on that? If not, we will move on. Okay, let's head to the next question.
Okay. So we, in the past summits, we've spent a lot of time on those core competencies. And so this is our next step. The beginning of our next steps is getting the feedback from you all of what training is needed, what is essential. So there should be a link dropped into the chat for you to answer a couple of questions. The first is, where have you had the most success with finding training for your family support professionals? And where do you need more training? So what we'd like for you to do is look at that form and let us know what 3 home visiting and parenting education topics you believe you have had the most comprehensive training for, and enter that into the survey. And then the other question, where do you need more training? What are the 3 top education topics that you believe you would like more training on?
And Patty, we just had a comment in the chat that can't do the poll because they don't have a Google account. So if anybody's struggling with it, feel free to answer them in the chat.
Yep. Jessica said she's working on that. And just while you guys are doing this, just know this is just the beginning. This is not okay, you're going to give us 3 things and that's going to be it. this is just a start to what kinds of things are the most in need and most valuable. And it took us, 4 years to get the core competencies to a point that we could even suggest them. So I can't imagine that the training piece of all of this is going to happen overnight. So your input is important, and we're gonna do our best to reach out to you in multiple different ways and multiple different occasions. So, so I'm seeing in the chat, child abuse and neglect is always helpful. Advancing racial and cultural humility, coaching strategies, parenting engagement, circle of security, parenting training, and another parenting engagement, resilience. Jessica, are you able to pull up the form, or is it?
I'm working on it. I'm sorry. My apologies.
That's okay. Mental health, resilience, a lot of engagement, and virtual visit training. And while we're waiting on the technology, that I'm going to just do a shout out for the virtual visit training. If you guys have not had an opportunity to look at the rapid response virtual home visiting virtual support website, there is so much support there. It's a collaborative effort between many home visiting models, and it's kind of model neutral for virtual home visiting support. Lots of videos and helpful documents. So, and some ACEs and trauma, child abuse,
All right.
cultural competence.
Sorry, Patty. I believe I've adjusted the settings, but I do have the results pulled up.
Okay.
It looks like let's see, we have 60% have said child development, birth to 3 years old for that first question is where they feel they have had the most successful training, is from birth to 3. There's others who have said trauma-informed practice. They feel like they've had enough training, as well as family engagement, child abuse and neglect, and promoting positive parenting. So those are the majority for now.
And then Paulinier put in the chat the link for the Infant Early Child Mental Health Association's trainings. They're in the process of updating that. So that's another place to go to look for support for some of these topics in the meantime. Okay.
And more results are coming in, and it looks like where folks do need the training is in that infant mental health. So that's a great link that Paul just shared.
Mm-hmm. Yeah, I think if the pandemic has highlighted anything, it is the need for mental health across the board. All ages, especially with children. All right, should we go on to the next, our next attempt at capturing input?
Yeah, so we've got 2 questions here for you to give us some input and suggestions on. hopefully all of us have been to had the experience of going to a training that you really felt was effective. You learned a lot. You took a lot away from it that you were able to then begin to use on the job. And so, as part of this work, we don't want to just know what trainings folks feel like they've got enough access to and where the deficits are, but we also want to look at the quality of that training. And so if you would take the time here to go to the Menti link that Jessica just put into the chat there for these two questions. The first question is just give us a word that describes a successful training. And then that second question, what word describes how you would improve a training? When we were talking about this as we were getting ready for the session today, we weren't quite as polite with that question. And so if it's not polite, it's not polite. But, we've all been to trainings that was terrible, that we felt like was a waste of our time or just we didn't get anything out of. And so we really want to know what are the things that describe that kind of training that really is not useful to folks. So if you would take a few minutes to put those in, then we'll take a look at what things are coming up with that as well.
And I know in our work, we're generally strength-based and positive, but it's okay for that question to put something negative in there if that's how you felt about what you would need to improve.
Yeah, honest criticism is nothing to be afraid of. And I could describe a number of trainings that I've done that fit into that second category of a total waste of time once I got done with them. And I'm talking about ones that I have presented to folks that I regretted ever having to make folks sit through. So I think we've all had that experience. And again, the more we can sort of unearth what those things have in common, then the better we can be at really making sure that we are providing quality training for folks across the board.
I'm gonna stop sharing my screen for a second so I can switch over to the Menti and
great.
hopefully share that. We'll give that a whirl.
Yeah. Seeing it yet, Rachel?
Give me just 1 second. I think it's still loading.
Okay.
Okay, let me see if I can share this. All right, are you all able to see that?
Yes.
Okay.
Yes.
So it looks like we've got ourselves a theme.
Yes. Engaging, interactive, resources, relatability, real world experience, examples, replicable. Definitely when we think about the work in sort of a systems kind of approach, is that idea of training that can be taken across the board in lots of different areas and used. Can we take a look at the one that describes how we can improve training?
All right, let's see if I can get that one going.
I love that engaging is the center and the biggest.
Yeah.
Hold on. Here we go.
I would have to agree with that input. And this supports that. interactive and interaction. Sounds like training should not be a lecture format of any sort. More
Yep.
hands-on.
And we've got parent voice down there right under interactive.
Yep.
Again, as we're thinking about systems work, really understanding that parents and families and the kids that we serve are part of that system. They're not just something that the system acts on, but they are part of that system as well. And we want to try to include that in all the levels that we are working with. As we've seen today from the parent panel and in other presentations that have been part of the summit to this point as well. And Mary just popped in, not successful, boring. So yeah, if we don't have folks that are interested in what we're saying, the things that we're doing and how we're doing it, then we all shut off and aren't going to participate in that.
And
all right. Well,
Mary
thank y'all.
Beth also put in the chat, Mark, that when these trainings are virtual, it's even more important to have an engaging trainer that brings energy to the process and unique. I think I can go on to say unique ways of presenting the material and making it interactive.
Yeah, absolutely. So I apologize for my participation today right off the bat on that one, guys. Sorry about that.
Well, that's I was looking at engaging and thinking, oh no.
So, all right. Well, thanks for y'all's thoughts on that. We will move on to the next slide here.
Give me just 1 second. I have too many windows.
So, I know we're getting close to time here, so we want to make sure we have a chance to get this other information.
Let me get back to. And then here we go. All right, can you see the PowerPoint again?
Yes, thanks.
Excellent.
I have too many windows open as well. I can't see where we are. Darn it.
We're at the professional sports.
Okay.
Poll.
So this is another poll that we need to want to look at. What kind of professional supports do y'all think would be the most useful? What else do you need for your home visiting and parenting education practice that would support you? And this isn't so much topics or training topics, but what kind of support? Some of them are listed below, coaching, mentoring, reflective supervision. So is there a poll, Rachel?
Yeah, so the poll has been launched and folks are taking the poll.
Oh, okay. Sorry.
No problem, Patty.
I have too many things open on my screen.
I understand.
So.
We have about 50% of folks who have answered, so we can give them another moment.
And I'm used to having two screens and I don't only have one today. So it's an impediment.
All right, and I'm going to go ahead and close out the poll. and I'm sharing results. Patty, since you can't see, I'll just let you know that there's 18%.
I can see them now.
Oh, perfect.
So it looks like peer mentoring. No. Learning cohorts and communities of practice is the highest, followed by peer mentoring, which is interesting. And then mentoring and coaching, group reflective supervision, and supervision coaching. I assuming that's coaching for the supervisor is what was meant by that. So a lot of our models offer communities of practice as well, and the peer mentoring, but that's some great information. So thank you all for sharing. I guess we can go to the next poll because we're running out of time.
Yeah, real quickly here. So there's a link for the idea boards, and we know that list on that last poll was not comprehensive, and so we would like to know, are there other support needs that are there to help folks? Are there issues that impact implementation with fidelity, with models and other approaches that need to be considered as we're sort of continuing to build the system, particularly from the programs committee standpoint. So if you would go to that link and create a post-it note, if you see one that somebody's already got it, you can just click on that and add your response instead of having to do another post-it note from there. So we'll give you just a minute or two to do that. And Jessica, can we see that one?
Yeah, so everyone should be able to see the answers via that link that I just shared. And Rachel, are you able to share it on the screen?
Yeah, give me just 1 second.
And Mark, we could probably jump ahead and go ahead and say our thank yous while everybody's doing that, to respect everybody's time. And we can leave that that idea board up for a while, and just know that all this information that you shared with us is going to be kept and looked over and processed, and we appreciate everything that you've shared.
Yeah, we do greatly appreciate your input. And again, the last slide has Rachel's contact information there. So if you're interested in participating on the programs committee, definitely get in touch with Rachael and she will get you plugged into that.
Rachel, can you put yours your contact information in the chat, since we're not
Absolutely
showing the last slide?
Sure thing.
Since we've
all right, Sarah just dropped it in there for you.
Ah, lovely.
Thank you. I couldn't get it in fast enough.
Yeah, Sarah's quick. But yes, please do feel free to get in contact with me about the committee or our work, or general questions, or sharing feedback.
And thank you all again for everything that you do for our families and our state. It's so important.
Absolutely. We appreciate your participation. Y'all have a good afternoon.
Bye, everybody.
Bye-bye.
Bye. Thank you all so much. And Patty, Mark, everyone, please stay tuned for our next session. It will be coming along at 2 o'clock with Sarah Lang and Malia Rose Waters. In addition, I am popping a survey link in the chat to provide your feedback on this session. Please continue to add feedback to the idea board. This will stay open live for quite a long period of time. So whenever you think of that feedback, please just pop it in. Thank you all so much.
Thank you all. Be sure to fill out the survey. If you have any questions, special events at smartstar.org. And we look forward to seeing you at 2 o'clock for our next session with me, Malia, and Rachel. So see you then.